Hi, everyone. Welcome to our presentation on Williams syndrome. It's going to be myself, Annie Martzel,
And me, Tia Hillman.
and here we go. So, Williams syndrome, what is it? Williams syndrome, also known as WS, and also known as Williams-Beuron syndrome, is a rare neurodevelopmental genetic condition caused by a deletion on the seventh gene. Typical characteristics include cardiovascular problems, endocrine problems, delayed development, cognitive delays, hypersocial, and low tone. There are some other features as well that are fairly typical in the physical features for someone with Williams syndrome, including an upturned nose, a wider mouth, smaller teeth, a smaller jaw, and larger ears.
So, as Annie mentioned, the cause of Williams syndrome is completely genetic. It's caused by a microdeletion on one copy of chromosome 7, as you can see in the diagram in the middle. It's a microdeletion, so it's a very small part of the chromosome that is missing. And it most often occurs spontaneously due to an error in meiosis during DNA duplication early on. So, it's not typically hereditary, it'll most often occur randomly. And some of the key genes impacted that are missing include the ones listed below. The ELN gene codes for the protein elastin, which is important for allowing the lungs, skin, and arteries to stretch and constrict. So that gene is missing. Also, the GTF2I gene contributes to intellectual disabilities that may arise, as well as hypersociability and behavioral characteristics often seen with this syndrome. And then the LIMK1 gene is linked to deficits with visuospatial cognitive abilities. So sometimes people with WS have visual perceptual and visual motor integration difficulties. And then one more is the STXIA gene, which is linked to neuropsychiatric disorders that can co-occur with Williams syndrome, including depression and anxiety. The prevalence of Williams syndrome, there's fewer than 200,000 people with the syndrome in the United States, so it's pretty rare, according to the NIH. The worldwide prevalence is estimated to be 1 in every 10,000 people. However, there are lower rates reported in some countries than others due to diagnostic barriers, since it's diagnosed through genetic testing, and that's more available in wealthier countries as opposed to others. So some important medical management for Williams syndrome. About 1/3 of Williams syndrome patients will need surgery to correct vascular stenosis, due to the elastin insufficiency that we talked about. They often have hypertension as well and will most likely have a close relationship with their cardiologist and will require lifelong monitoring of their vessels and blood pressure and all of that. Williams syndrome patients should also have their thyroid function checked every 2 years, as thyroid problems can occur later on. And also, ADHD and anxiety are common comorbidities for Williams syndrome patients, so those can be treated pharmacologically. And there's also studies that show cognitive behavioral therapy is very effective with this population as well. For the prognosis, it's a lifelong syndrome with developmental delays, as we mentioned. So, due to intellectual disability and adaptive functioning, they may not necessarily be able to live completely independently. Some people will, some won't. And the burden of care can fall to the family. They also have an increased risk for type 2 diabetes as they get older, and a slightly higher risk of sudden cardiac death when compared to the general population, although it is just slight. The quality of life for patients and caregivers can be impacted by the frequent medical visits, financial burdens, and stressors arising from difficulties with ADLs, self-care, and problems with school or at work. And there's actually a study that shows 73% of parents report their child being bullied at school due to their hypersocial interaction style and lack of self-awareness when interacting with their peers.
So, what is the role of occupational therapy in terms of Williams syndrome? So, for kiddos with Williams syndrome, their strengths are their social and communication skills, and their primary weaknesses are their daily living skills and their motor skills. So, children with WS functional needs definitely have functional needs in the areas of fine motor skills, gross motor skills, emotional regulation, anxiety, social skills, and gross motor skills. So some of the assessments that OTs should be using to assess these kiddos, the BOT-2 and also the PDMS to assess their motor skills. SPM2, there are different forms depending on the age of the child. Typically, if they're in school age, really good ones to use are both the child and the school forms. And this will also check their assessed for sensory processing deficits. TBPS4 is for their visual problems. The SFA would be for their school function assessment. And lastly, the VABS, also known as the Vineland Adaptive Behavior Scale, will assess their activity participation. So that would be a very good assessment to use for this diagnosis. So again, areas for OTs to address would be fine motor and gross motor skills, ADL training, play, formal education, social skills training. Safety awareness is definitely a big one. Due to their hypersociability, they are not necessarily as aware of their social groups and who's in their inner circle. So they need to be aware of strangers and who are safe people for them to be able to interact with. And then as they get older, they will need to have transition to work training as well as community living. As Tia mentioned before, the burden of care most likely will fall onto a sibling, but if they do not have any siblings, then community living might be the better approach for them. For approaches, adapt and modify, establish, and create will be the best type of approaches to use for this population in terms of creating interventions. So meet our client. This is Xander. Xander is 7 years old. His socioeconomic status is middle class. And his family dynamic, he lives with his two dads and his older sister, Willow, who is age 9. And they live in the Bay Area in the suburbs just outside of San Francisco. He is a second grader. He's in the general education class, but he does have supports in school. He does have an OT in school. So fortunately, whatever programs we are able to come up with for him, hopefully they can generalize and transfer over into the classroom as well with the addition of the OT in the classroom. So he was diagnosed with Williams syndrome at 14 months old after going through genetic testing. So after our evaluation, the assessments that we had given to Xander, we gave him the Vineland, the BOT2, and the SPM2. So his parents also requested that they would like Xander to play with his sister without interfering behaviors. Some of the things that Xander likes, he likes playing catch. He's a very active kid. He also really likes pirates and he likes art. The deficits that we found, he does have a mild intellectual disability, but not so much that we won't be able to use any cognitive behavioral interventions. So we will be using that. He is also hypersocial. He does have emotional dysregulation. He also has physical delays, some cardiovascular problems, and low muscle tone.
So for Xander's present level of performance, we noted the 3 most important areas after interviewing him and his family and going through the complete evaluation. So we noted that Xander likes playing with his peers on the playground outside and with his sister, but he does have difficulties keeping up and staying engaged. He'll get frustrated just because of motor delays and has problems paying attention. He has difficulties at school with drawing and other fine motor activities as well. And then he struggles with appropriate emotional responses and regulation due to sensory deficits and decreased executive functioning skills. So next, we will be looking at Xander's first outpatient OT intervention session. So just to overview it, it's a 50-minute intervention session, and we will be using 3 activities: an obstacle course, an emotions matching game, and a coloring activity to address Xander's 3 areas of needs that we identified, including sensory motor play, coloring, and then his emotional regulation. So fine motor skills for coloring and then regulation. And these are our references. Thank you for listening. Okay, so today for the first half of Xander's intervention session, we are going to be targeting his sensory motor and play skills. Xander loves playing with his friends and his sister and is very motivated to participate with them at school on the playground or at home in his backyard, but he lacks a lot of the underlying skills that he needs to be able to successfully do so due to his low muscle tone, delayed gross motor skills, and also delayed visual motor integration skills. So those affect his eye-hand coordination, his dynamic, balance, postural, stability. All those skills go into plank catch, so that is what we're going to target today with this obstacle course that we have set up to help him coordinate bilaterally and also disassociate his limbs. And so the frames of references that we will be implementing are motor control, motor learning for teaching new motor tasks, and then also biomechanical for positioning and stability. Okay, so I'm going to walk you guys through the steps of Xander's obstacle course. So the first station, we have the trampoline jumping onto the crouch pad. So here, while he's on the trampoline, we are targeting his underlying skills of his standing dynamic balance, and also his coordination and timing of movements when we're going to ask him how many jumps that he wants to take, and then planning his jump onto the crash pad. And then once he's on the crash pad, and also on the trampoline, he's receiving proprioceptive input, which will help him modulate as he prepares for the more challenging tasks that are going to come through the obstacle course. To our second station, which is the balance beam, and we're going to use MCML to teach him the motor task of crossing the balance beam. It's again going to target his stability, his dynamic balance, also his planning of movements as he walks across, and comes to the peanut ball, where we're going to have him sit to target his balance in a different way in a sitting position, and also his postural stability while he's seated. And we're going to use the moon swing here to play pass. We decided to use the moon swing because the therapist is able to control the timing and kind of the speed and which direction it's going to make sure that it's the just right challenge depending on his skills. So we can have him pass it with both hands, one hand to disassociate. We can have it go out to the side to increase the challenge, have it go faster, slower, depending on how we need to upgrade or downgrade. And then we come to the actual occupation of plank catch. So we decided to use this bigger ball to start out since it's easier to throw and catch. To upgrade, we could use a smaller ball in the future, but for now we thought that this would be the right size. Hi Xander.
Hi.
I'm OT Tia. It's so nice to meet you.
Hi, OT Tia.
Are you excited to play today?
I am. I see a lot of fun stuff.
It's gonna be so fun.
Yay!
So, what do you like to play?
I love pirates.
Pirates are so cool. Do you want to go on a secret pirate mission with me today to find some buried treasure?
Yes.
Okay, follow me.
Okay.
Our first stop is we have to take some big jumps into the ocean.
Whoa.
How many jumps do you think we should take?
100.
100. Whoa, that's a good idea. But maybe we can pick between 3 jumps or 5 jumps.
Oh. 105?
Or just 5?
How about 3?
Okay, 3 sounds good.
Okay.
So watch me. We're gonna jump big, okay?
Okay.
1, 2, 3, jump.
Woo! That looks so fun.
Okay, you try.
Okay. Whoa. It's a little wobbly.
You're doing great.
So 1, 2, 3.
Whoa! I love how you took big jumps and you made it into the ocean.
That was so fun.
Nice job, Xander.
Thanks.
Okay, follow me.
I just went out of the ocean.
Did you make it?
I did.
Okay, next we have to walk the plank.
Oh.
That's something pirates do a lot.
Yeah.
So watch me, okay?
Okay.
Whoa. Made it, okay?
Okay.
So you want to step, step, step up, step down, step, step up. Now you try.
Step, step, step up,
Nice job, Xander. You made it up.
step, step, step up.
Whoa! You walked the plank, Xander.
Oh,
You can step down. That was amazing. You made it all the way to the end. You stepped your feet one in front of the other, up and down so nicely.
that was fun.
I love it.
What's
Okay, you made it to the sword fight.
next?
I know,
No.
I know. So, why don't you have a seat right here and I'll show you what we're gonna do.
Okay. Like this?
Yeah, just like that. How does that feel?
Feels good.
Great. So, we are gonna do our sword training, okay?
Okay.
So I'm gonna to you and have you practice with both your hands so you get super good at your sword fighting, okay?
Okay.
So why don't you start with both hands, okay? Whoa, that was a good push. I like how you pushed it so hard it came right back to me. Let's do it with both hands a couple more times. Nice job.
Whoa.
Whoa, you did great. I swung it to the side and you were ready for it. That was awesome.
Whoa.
Ooh, I like how you noticed that it was out to your side. Next time, maybe use the hand that's closer. I
Okay.
think that'll be easier, okay? So let's try again. Yeah, that was so good. You used the hand that was closer. That was awesome. Woo. Yeah. Okay, now try with one hand. Nice. The other hand. Whoa, Xander, that's amazing. You finished your sword training.
Now we can fight Captain Hook.
Exactly, you'll be prepared. Woo. Okay, I think we can go find our treasure now. Do you see anything big and golden around you?
Is it this?
Ooh, that is big and golden. I was thinking of something big, golden, and round.
Oh, over there.
Yes, it's our treasure.
Wow. We found it.
You did it.
Woo.
Okay, let's practice. You can stand up and we can toss it back and forth a couple times to make sure that it's real.
Okay.
Real gold.
Okay.
Ready?
Whoa.
Nice catch, Xander.
Thanks.
Does it feel like real gold?
Yeah, it feels heavy.
Nice. You're doing such a good job using both of your hands and looking at the ball. Hooray! You get the treasure! Good job, Xander.
Can I take this home?
Yeah.
So in the second half of the intervention, we are going to be targeting Xander's emotional regulation, social play, and fine motor skills. So Xander presents with decreased emotional regulation due to sensory deficits and deficits in his decreased executive functioning. So while it is common for children with Williams syndrome to be overly social, they most likely will be hyperreactive in situations and will need to learn sensory strategies in order to modulate themselves. Xander also presents with decreased fine motor skills due to low tone, visual motor delays that are impacting his VMI, and also difficulty sustaining attention to tasks. So the second half of the intervention will address the underlying skills that he needs for emotional regulation, including recognition of emotions, and the underlying skills for fine motor tasks using a coloring activity. The outcomes we expect to see are improved fine motor coordination, emotional recognition, and emotional regulation using sensory strategies, which helps build a foundation for social play and other interactions. The frames of reference that are included are AIR sensory integration and also the use of motor control and motor learning theory. So for the first intervention, we are going to be targeting emotional recognition. So since Xander has decreased emotional regulation, we are going to be teaching him the foundational skills of actually recognizing emotions in others. This is a task that is difficult for children with Williams syndrome, so it is an important one to teach. He also presents with mild ID, so we are going to be kind of keeping our task simple. Right now, first we have this sheet, which shows 4 different emotions, and we also made sure that we're going to keep it with actual human children. So this is happy, angry, sad, and scared. So the occupational therapist will have this sheet and present it to Xander, and then he is going to need to flip these over and match with the sheet. So this is a beginning way of him understanding what the emotions are. And as we go through this task, we will also talk about emotions and how to recognize them. To upgrade this task, we would also cut these out and make it a matching game. So he would have to flip this over and flip one of these over in order to find both of them to match it. So that would be the upgrade for this task. To downgrade it, we would use less. So instead of 4, maybe we would start with 2, just to get him used to that as a downgrade. And also in terms of emotional regulation during this task, we're also going to be teaching him a regulation strategy called lazy 8 breathing. So in this task, we're going to be teaching him to start breathing here. They start at the star, breathe in for 4, and out for 4, and then back to the star. So this is a way to have them learn how to breathe and have that sensory strategy, so that when they do get upset, this is a strategy that they can count on to regulate themselves. Next activity that we are going to use in this intervention is going to be a fine motor activity. This is going to be a coloring activity for Xander. Once again, we are going to be using some different emotion faces, but that's not the main portion of this activity. The main portion is actually going to be focused on his fine motor skills, including accuracy in terms of being able to color within the lines. So we want to make sure that he has attention to detail for that. So his attention skills are being worked on, as well as his fine motor skills, including grasp as well. So that's the main focus of that activity. However, we thought it would be fun to add in some of the emotions as well, just in case, as an upgrade. As a downgrade, we wouldn't necessarily have to use the emotions. We could use any type of aligned coloring page. We could increase the lines, the thickness of the lines, so that it's easier for Xander to understand where he needs to stay within the lines for accuracy and also attention. If he does get upset during this activity, we could also bring in the lazy 8 breathing again. So this would just be reinforcing the strategy that he has learned. So again, we would use this as a strategy to reinforce the sensory regulation techniques. So in between these two activities, though, we want to get him kind of up and moving around a little bit, because both of those activities might be overwhelming for him, and sitting still for too long might be too overwhelming as well. So in between these two activities, we're actually going to have him come over here and do a couple of jumps on the trampoline and into the crash pad. So that way he's going for modulation. So that way he will be modulated and his body will be ready to do the other activity.
Hi.
Did you have fun with OT, Tia?
So much fun.
What did you do?
We played pirate.
Wow, that sounds like so much fun.
It was really fun.
Well, I have a really fun game for us to play.
Ooh, what is
Are
it?
you excited?
Yes.
I'll show you, but first we need to go over here to the tables. All right, yeah, that's it. Good job. Just gonna make sure you're sitting properly in your chair. There you go, feet on the ground. There we go. Perfect. How do you feel?
Excited.
Excited. Good. So we are going to do a really fun matching game.
Ooh, I don't know that game.
You don't know it?
Mm.
Well, I'm gonna teach you. Okay, so first, I have some friends on this piece of paper.
Ooh, I love playing with my friends.
I know you do. So these friends have different emotions. Do you know what an emotion is?
Like when I'm excited.
Yeah, that's right. So excited can also be another word for happy.
Happy.
Yeah, so do you see this little girl? She's smiling. She's showing that she's really excited and happy.
I think
So
she's
that's-
at the beach.
She is at the beach.
That's
Good
fun.
job. That is fun. That's probably why she's so happy. And what do we think about this guy in the corner? Does he look happy?
No.
No, he doesn't. It looks like maybe his body language is showing that he's
Sad.
mad. That's right. And you know what another word for mad is? Angry.
Angry.
Yeah, so he is angry. And sometimes our friends can get angry, right?
Yeah.
And sometimes maybe we need to know what that looks like. And what about down here? Does he look happy?
He's crying.
He's crying. And what do you think that means when someone's crying?
He's sad.
Sad, that's right. And you know what? That's the word right underneath it.
He's sad.
Yeah. And what about this friend over here?
I don't know about that one.
I know, that one's a little tricky, right? But this one, he's kind of scrunched down a little bit like this. And he's worried or scared.
Oh, there's something scary.
Something scary. Yeah, like maybe he's watching a scary movie that he's not supposed to watch. Or maybe there's something not
I'm scared of spiders.
spiders. Maybe he's looking at spiders, right? So this might be something that you would see if someone was scared of spiders. So that's scared. So what we're gonna do now is these same pictures are all mixed up here on the desk in front of you. So what I want you to do, I want you to pick one up and turn it over.
Which one?
You can choose whichever one you want. Which was the first one you think you want to pick?
This one.
That one. Okay. What do you see?
I see a boy.
A boy. Okay. And does he look as if he's smiling, or does he look?
No, he looks
He
mad.
looks mad.
Yeah.
Ooh, yeah. So do you think which one of these do you think he would match with?
This one.
That's right. Good job. Let's try it again.
Okay. Ooh, the girl at the beach.
The girl at the beach. And was she
Remember,
excited to be at the
yeah,
beach?
she's smiling.
She's smiling. So when you see someone smiling like that, what do you think that means?
That she's happy.
That she's happy. That's right. Can you match her? There we go. There she is. That's happy again. And then, oh, who's the next one?
This one.
This one. Ooh, what's that
Oh,
one?
I don't remember.
Oh, okay. I'll give you a hint. How do you feel when you see a spider?
I feel scared.
That's right. And do
So
you
she's
see
scared.
her? She's scared. That's right. That friend is scared. Can you find which one on here is scared?
This one.
That's right. good job. Okay, one more, let's see.
The boy, he's crying.
The boy who's crying, that's right.
Yeah,
When you see a friend who's crying, do you know what that means?
they're sad.
They're sad. So maybe we should match him up with sad. Great job, Xander. You matched all of them.
Yay!
Oh, well done. I like the way you chose each one, and I like the way that you matched them all together.
I did it.
You did it. You did great. So, Xander, sometimes do you get angry
Yeah.
or frustrated? Do you feel overwhelmed?
I don't know what that means.
It means you don't know what to do.
Yeah,
When
when
you
I
get
get mad, I don't
mad.
know what to do, and I just run away.
Oh no. Well, that's not very safe. So, something that I want to show you is this cool thing called lazy 8 breathing.
Ooh, he's sleeping.
He is sleeping. You know what? This is a really fun way to get your body calm when you are feeling upset. So, what this is, can you find the star? That's right, good job. So, what you do, you trace in a pattern like this. So, you trace with your finger and breathe in 1, 2, 3, 4, and breathe out 2, 3, 4.
Okay.
Okay, so now that I've showed you, your turn. You try it. I like the way you're tracing with your finger, and I like the way that you're breathing in and out. How do you feel?
That was nice.
Yeah,
Yeah,
that feels pretty
I
good.
feel calm.
Good. So this is a great way to feel calm and to calm our bodies down. Yeah. Hey, I know this is a lot, so do you need to have a little bit of a wiggle break? Okay. I know OT Tia had a really fun activity where you got to jump into the ocean.
Oh, can I jump into the ocean again?
Yes, so I brought, oh, wait, hold on. Wait for the OT, okay?
Thanks.
I want to make sure everything's nice and safe. I really like the way you listened and you stopped. Good job. Okay, how many jumps? How many jumps did you do? 5. Did you do 5 jumps with OT
No,
Tia?
I want to do 5 now.
You want to do 5 now? Okay. Here, I'm just going to move this out of the way real quick so it's safe. Okay. So let's do 5 big jumps and then we'll crash in the ocean. 5. Woo! Xander, how do you feel?
Good.
Ready for the next part?
Yeah. I see faces.
That's right. So we've got some fun faces to color in. So what I'm going to show you first is how we're going to color in the faces. Okay? So look like this. We're just going to color, staying inside the lines. Color. Being very careful to stay in the lines. And we're going to keep our, you see right here?
Mm-hmm.
We're going to keep our pads of our fingers right here. Yeah, that's it. Why don't you pick up one?
I want red.
Red. Ooh, yeah. And which face do you want to color?
The angry face.
Angry face. Good job recognizing the angry face. I like the way you recognize that. Okay, why don't you show me? I like the way you're coloring. Next time, try and stay inside the big circle line. Great job. You're coloring within the lines. Oh, I like the way you're making him red. Let's stay in the lines.
This is hard.
I know. Are you getting frustrated?
Yeah.
Okay, here. This is a really easy way to calm down. Do you remember our lazy 8 exercise? Do you want to try that right now? Yeah, let's try it. Remember, where do you start?
The star.
The star. Yeah. How's your body feel?
It's okay.
Better? Do you
Yeah.
think you might want to try again?
Yeah, it's just hard to stay in the lines.
I know. It's a tough skill to learn, but I really like the way you stayed in the lines here. I think you can do it again. That's it, Xander. You stayed in the lines. Look at that.
He looks really angry.
He does, but you know what? I like the way you stayed in the lines. How do you feel?
I feel better.
Good.
I did my best.
You did. So to conclude our session, we would end with parent education. So that would include giving them handouts. For example, we would print out the Lazy 8 briefing so that they can take that home and do it at home.
And we would also explain to Xander's mom some of the gross motor activities that he completed to target different skills. And if she was interested, we could make suggestions for some equipment she could get for him to use at home, like maybe a little trampoline for proprioceptive input to work on his balance at home, or even a tetherball for their backyard, things like that. So if she wants to work on those things at home, she'll be able to.
And we would always incorporate family-centered care.